Professional sports have them. Colleges have them. Even the Army has them. Who's this them, you may be asking? Why, it's athletic trainers, of course. According to the University of Texas Athletic Training Education Program website, athletic trainers are healthcare professionals who specialize in the prevention, assessment, treatment, and rehabilitation of injuries and illnesses. Athletic trainers are beneficial to sports and athletes within a community, and they should be placed in every high school that participates in sports. Some of y'all were athletes in high school and kind of met some athletic trainers. If you weren't, maybe your kids in the future will play sports and they'll need the help of an athletic trainer. The athletic trainers are trained to handle life-threatening and non-life-threatening injuries and illnesses. They're also a cost-effective solution to large doctor visit bills stemming from long-term injury rehabilitation. First, athletic trainers are trained and prepared for emergency situations. According to the National Athletic Training Association website, athletic training encompasses the prevention, diagnosis, and intervention of emergency, acute, and chronic medical conditions involving impairment, functional limitations, and disabilities. Also, more than 70% of athletic trainers have their master's degree, meaning that most athletic trainers are even more prepared to handle emergency situations. Some of the more serious injuries that athletic trainers are qualified to take care of are head and spinal cord injuries, broken bones, excessive blood loss, and heat and cold related illnesses. They're also capable of treating sprains and strains, common illnesses and allergies, as well as an array of other injuries that include chronic injuries. They can also help rehabilitate athletes of all ages and athletic ability back to activity, whatever that activity may be. As stated by the United States Bureau of Labor Statistics, as people become more aware of sports-related injuries and how often they occur, the demand for athletic trainers is supposed to increase, most specifically in high schools and youth athletes. This means that people are starting to realize the importance of athletic trainers and what athletic trainers can do for younger athletes. There are now around 35,000 practicing athletic trainers in the United States, which is a big increase from 1950, when the National Athletic Training Association was established, in which there were only 200 practicing athletic trainers. So the profession is growing and continuing to grow. Athletic trainers are vital to the health and sometimes even survival of youth athletes. Secondly, athletic trainers are more cost-effective for parents. Payscale.com reports that the median salary for an athletic trainer, starting athletic trainer, is around $38,000 a year. And if you think about a younger athlete having an overuse injury in which they have to go to repetitive doctor's visits, those bills can add up. Whereas athletic trainers that are employed by high schools are paid through property taxes, like most school districts use to pay teachers. Due to the ability of an athletic trainer to help save the life of a youth athlete, whether it be a head or spinal cord injury or the increase in cardiac arrest that athletes are experiencing today, if you think about how if an athletic trainer wasn't there and that person were to die, the average funeral cost, according to Funeral Planning 101, states that a funeral can cost up to about $15,000. So the salary of an athletic trainer is worth it if it saves a life and that overall cost that could have happened if an athletic trainer wasn't there. Athletic trainers can save the lives of athletes young and old by being first responders on the scene of an injury. They are trained to deal with on-site injuries. They're an inexpensive solution to physical therapists and repetitive doctor's visits. So why would you not want to have a qualified person help you out if you were that young athlete or your kids in the future? If an athletic trainer wasn't there, the most qualified person would be the school nurse, if they were still there after school for practices or games. or maybe even coaches who just have basic CPR. So why would you not want to have an athletic trainer who's more prepared for those situations, available to help with those injuries? Athletic trainers should be placed in every high school to ensure the safety of youth athletes.